Breaking news this noon time. Huge development in the fight against COVID-19 here in Rhode Island and across the United States. After FDA emergency approval this weekend, take a look here. Lifespan sharing this video with us. They recorded boxes and boxes of their first shipment of COVID-19 vaccines. First shots expected to be administered to Rhode Island healthcare workers later today. Queens, New York, where the first person in the United States received the vaccine early this morning. A critical care nurse. Queens was picked because it was one of the areas hardest hit when the pandemic began. It's part of the story playing out from airport tarmacs to hospitals all over the country. FedEx sharing this video and images from Tennessee and Michigan, loading cargo planes full of the vaccine vials. 12 News reporter Brandon Truitt joining us now live, starting our team coverage in Providence.
Well, Patrick, we've been seeing those images of the logistics playing out across the country, but nonetheless, it is here. The first doses delivered to Rhode Island Hospital just this morning. I want to show you more of that video from Lifespan showing the unboxing of those first doses. This happening just before 8:30. They were delivered by FedEx, and you can see the healthcare workers wearing those gloves as the doses are shipped in dry ice. Remember, this Pfizer vaccine has to be kept at -94 degrees Fahrenheit. Now, the state says one of the reasons the vaccine is coming to hospitals first is because they already have the necessary equipment to store it properly. It will be in those freezers before it being administered this afternoon. Lifespan says high-risk healthcare employees from housekeeping, nursing to intensive care will be first in line. More on that in just a little bit. But I want to show you this. Look at the facilities the Department of Health says will get the vaccine today and tomorrow. These are both Lifespan and Care New England properties. Kent, Newport, Rhode Island Hospital, along with Women and Infants and the Miriam. Employees there are on tap to get vaccinated too. Now, the state says that each of those facilities is getting an initial round of doses of about 1,000 each. That's all a part of phase 1A. Also a part of that group we know are long-term care facilities, nursing homes. 12 News has now learned that those facilities expected to get it a little bit later than initially thought. Now after Christmas, that is a bit of a delay, with the state saying that's a more operationally feasible timeline. Nonetheless, doctors and medical professionals here at Rhode Island Hospital set to get vaccinated this afternoon. Live in Providence, Brandon Truitt, 12 News.
Now, the vaccines are officially able to be administered in Rhode Island because of an advisory committee's final vote. We first brought you the breaking news this morning that the state's COVID-19 vaccine subcommittee overwhelmingly approved vaccinations to start at these hospitals. Alexandra Leslie was listening in on that emergency meeting this morning. She joins us now with more.
After two independent federal advisory committees recommended Pfizer's COVID-19 vaccine for emergency use, Rhode Island's experts had a big decision to make this morning. Monday morning, Rhode Island's COVID-19 vaccine subcommittee was asked to consider a recommendation to hospitals to begin vaccination of their high-risk staff, specifically those 16 years of age and older who don't have a history of anaphylactic reaction to any of the components of the Pfizer vaccine.
A majority have voted yes to recommend hospitals begin vaccinating.
There are some considerations for which frontline health workers can go first. The group said pregnant and breastfeeding women should be offered the vaccine.
And it would be up to that woman to have that conversation with her healthcare provider for, to do a risk assessment.
Those who previously had COVID-19 infections should still be vaccinated.
If they received monoclonal antibodies or convalescent plasma for COVID-19, they should wait 90 days.
And those who have received any other vaccine, like for flu, are advised to wait 14 days. The subcommittee said it is safe for some with a history of allergies or severe allergic reactions to get the shot, and they'll be monitored for at least 30 minutes. Current guidance says those who are allergic to components of Pfizer's vaccine should not get it.
The polyethylene glycol, which is in a number of injectable medications, and that is known to, in very rare cases, to cause severe allergic reaction. So this is the one group of people who should not be vaccinated at all.
The subcommittee said even healthcare workers currently infected could still get the vaccine, but should try to wait until they have no symptoms or at least 10 days after their isolation has ended. I'm Alexandra Leslie, 12 News.